It's good to see old friends. Very good to see new friends as well. Hi Yin. It's good to see you all. I haven't been here for a while, and I want to begin by thanking you all for all your good metta and your concern when my daughter was very ill recently. She has recovered and back on her feet now. And I only came out this morning because my daughter was attending a friend's wedding dinner in JB yesterday night. So that's why I had to send her back to Singapore early this morning. Now she stays in Aljunied Crescent. So you see, life is always full of stress, one after another. So today I'm very grateful to be here, and today my sharing is on a good death, because that's something which is the common denominator of all of us, whether you like it or you don't like it, whether it sounds nice or it doesn't sound nice, but that's the common denominator for every one of us. So begin with, I'm going to do a sound test and also to share a video. Let's test the sound first. That's good. That is what all of us will go through. Again, whether we like it or not, we are all going through that process. And so don't look down on small little things, okay? Small little speakers can be very powerful as well. So, you know, one of the stories I like to share before I begin the formal talk is a very nice Zen story which teaches us a very profound lesson. And it goes that there's this great Zen master, and then some rich official was having a new house. And so the great Zen master was invited to the house to bless the house as he was moving into a brand new mansion. And so yes, all that chanting, etc. was done. And an official asked the great Zen master, who is also a renowned calligrapher, can you write something for me to hang beautifully in my hall, a scroll of your beautiful calligraphy? And the Zen master says, sure, no problem. Bring out Manfong Seipo. Okay, put out. So he took, and then he wrote, grandfather die, father die, son die. And so he said, there, that's my blessing to you. And so the official was shocked. I said, I asked you to bless my house. I didn't ask you to curse my whole family. You wrote grandfather die, father die, son die. And the Zen master said, this is the greatest blessing I can offer you, because this is the natural order, the natural sequence of events. The grandfather dies first. And after that, the father dies. Then after some time, the son dies. He said, in this natural sequence of events, you have the least pain and suffering. If ever this sequence or order is upset, your whole family would be in great stress and turmoil. Death is inevitable. It is something that every one of us would face, and it is a bit unfortunate that in our Chinese culture, we avoid the topic. We don't want to talk about it. Chinese New Year, cannot talk about that. Birthday, cannot talk about that. So many events, cannot talk about it. But that's denial, because literally, it is part of our lives. We cannot escape from that reality. So what the Buddha taught is that instead of running away from that reality, make use of that reality, and let us see how we can deal with this in the most appropriate way. Since most people are terrified of death, including the person who is dying and those people who are taking care of the person who is ill, most people are at a loss and quite helpless. So Well, the first thing we do as brothers and sisters in the Dhamma, as attending doctors, as students, nurses, friends, the first thing is for us to minimize fear. That's the most important thing. I'm sure there are quite a number of medical people in this room. Can you just raise your hand? Let me see. How many medical people? Yes, Henry, is there any other person? Medical, nursing, yep. So, well, the first thing we do as people in the professional line of taking care of the sick, and we do see a lot of people who are dying, is to minimize fear. And death need not be frightening. It is only frightening when one does not know anything about it and is not prepared. And whenever we say we want to have a good death, please remember there are three parties involved. You've got a sick person, you've got his family, and then you've got a doctor. So there are three parties involved, and all these three parties should ideally be well trained before the event, which means every one of us sitting in this room, every one of us one day will face this event. Similarly, all of us have relatives, have friends, etc., who will similarly have this event. And those in the medical line, we deal with this every day. So in this sharing, I attempt to address all the parties. But one of the first things I want to raise is to the doctors and nursing people in this room. Doctors are not taught about dying. Doctors are always taught about not dying. The whole focus in medical school is teaching us to save lives. But actually that's not the end. Doctors also must be taught how to handle death. We have to certainly learn that death is not failure. Because as long as people look at death as failure, then you're going to overtreat many, many people. Because the reality is that until about 50 years ago, everyone dies a natural death. That's why when you go to the coroners, they have this line called death by natural causes. Nowadays, nobody dies by a natural death unless you happen to die at home. Okay? Because it is intervention. And the reality is we have to know when to intervene and when not to intervene. And so similarly, among us sitting in this room, we also have to give clear instructions as to when I want intervention and when I do not want intervention. In Metta Lodge, I actually print out for the members there an advanced medical directive, which I modified from the internet. But in Singapore, you don't have to do that because the Ministry of Health in Singapore has one ready one provided for you all. So every one of us must be very clear in our minds, hopefully at least a little bit clearer after this sharing, as to what you want to write in that form. In Singapore, it's a standard form. So it's a very good way because, as I said, doctors are taught about not dying. Very few medical schools actually teach doctors about how to handle the dying. And most doctors look at death as a failure. But the reality is, it is not a failure. All of us must die, including the doctor himself. So we must not go on treating dying people beyond the point at which it provides benefit because of pressure from relatives or a fear of perceived failure. And people nearing the end of their life should only receive medical intervention, pain relief, sedation, drying of secretions, if it is appropriate and proportionate. It is actually very ridiculous to put someone who is obviously dying through a long process of all sorts of measures just to prolong the dying process. I always teach my medical students, death is an event. The dying process can be a very long-drawn process. So what are we prolonging? Are we prolonging life, or are we prolonging the dying process? Okay, so when it is clear that it is the dying process, we should withdraw and just provide relief. Okay, of course, among those in the medical world, my students always ask, then should we put up an intravenous line in someone who is obviously dying? So we say it depends. If it is at home, I would say no. If the person is obviously dying, there is no role to put up an intravenous line anymore. You're just prolonging the dying process. In your hospital, of course, there are a very different set of situation, whereby sometimes you have to do it because of perceived fear that you are not doing anything. And that is not right. Because it is this simple. The goal of care for most patients at the end of life is one simple word: comfort care. Whatever we do, we want to let the person have a good death. And that good death means comfort care. Please remember, the first dictum in medicine is cure sometimes, treat often, comfort always. The main duty of the doctor is to comfort always. Ajahn Brahm, when he was in JB, asked my medical students, what is the most important role of a doctor? So some medical students will say to treat, to diagnose, to cure, etc., etc., etc. Ajahn Brahm corrected them by saying, no, the most important role of a doctor is to care. The rest falls under the category of care. And care includes knowing when to stop intervening. Fear. Now this is the most fearful thing. Anyone diagnosed with a terminal illness, for example, is having a fear that I am going to suffer in pain. This is especially true if that terminal illness is a cancer. Yes, no doubt some cancers are very painful. Cancer of pancreas, for example, is very, very painful. So the first fear is the fear of pain. But within the ability of modern medicine nowadays, there should be nobody who should die with pain. Modern medicine is such that we can prevent people from dying with pain. And I always tell my students, let the patient die in the arms of Morpheus. Morphine is the most effective and, I would say, potent pain reliever. Because morphine not only relieves pain, it reduces the sensation of breathlessness, because people tend to feel breathless. And the more important thing is, it relaxes the mind. Just to give you an example, during, or rather just after the Chinese New Year, one of my medical students living near the school had a small little accident in the house. Her mom came down, Chinese New Year, cook, etc., etc. But because her mom was not familiar with the gas stove in her condo unit, didn't switch it off completely. So she was in school doing some things, and then the mom called her and said, we are leaving now, when you come back home, just switch it on and warm up the food. And it's all ready for you. And that's what she did. She went back home and she lighted a match and it went boom. Because you can imagine, the gas stove was not completely off. So she had a lot of burns on her hands, her feet, and then, well, they're all far away from home. So the first person she called was me. Luckily, I was at home. So my wife and I rushed over. We brought her to the A&E, and there the doctors attended to her. And they gave her intravenous fentanyl, Henry. They gave her intravenous fentanyl. So when I saw her in the A&E unit, I said, are you still in pain? And of course she's in pain. Good Lord, when you're burnt, of course you're in pain. I said, no, fentanyl is not good enough. So I called the MO and I said, give her IV morphine 10 milligrams. And so she was given intravenous morphine. And I was standing beside her when she was given intravenous morphine. And you can see the face light up within one arm brain circulation. From here, injecting the intravenous morphine. Within one arm brain circulation, it reaches the brain. And you can see her relaxing. And I asked her, are you in pain now? And she said, no, I'm in heaven. Now you know why the drug addicts will kill you to get their fix. So we always tell patients, don't worry. Within the ability of modern medicine, most people need not have to die in pain. In the field of palliative medicine now, which is a subspecialty by itself, you know, Henry, they even have disposable gadgets for the patient to go home and inject themselves with the morphine intravenously. And after they die, the thing is just thrown away. So it is very, very effective. And for those who say, no, doctor, I don't want morphine. I want something that keeps my mind absolutely alert till the end. Well, yes, of course, you still have other drugs. You have the intravenous COX-2 inhibitors, which are not too bad, but not as effective as morphine. But seriously, I would suggest to every one of us, me included of course, do not fear morphine. There's nothing to fear other than the common misconception. All right? When you crush your leg in a fracture, your brain produces endorphins, natural forms of morphine in the brain. And that's why during a fracture, some people are not even aware until they look down and they say, oh goodness, I fractured my leg. Because at that instant, the brain releases endorphins, natural forms of opiates. So do not fear. It's not something which is very bad. It is very bad, of course, if you abuse it, but it is not very bad if it is used appropriately. All right? The next fear is the fear of separation. Well, all of us have our attachments, and so we fear, and we'll have to deal with that. And the third one is the fear of the unknown. But that is why you come to Buddhist fellowship every Sunday, to learn not to fear, because the unknown is known. So pain. Always reassure a terminally ill person and his family members that they will not be allowed to suffer, that they will not have to endure horrendous pain. An important result of this is like the polar bear there, he can lie there very peacefully and go on. So dying in the most comfortable way possible. Death is an event, dying is a process. We all want to die with dignity. We all want to die without regrets. How do we die with dignity? We don't want to have a terminal illness and then die with one tube in my nose, another tube down there, and then one tube draining here, and then an IV lying, and then an oxygen thing in my nostril. It really would depend on what you are dealing with. Of course, if you're dealing with something which is reversible, then by all means have all these things. But when we're dealing with something that is irreversible, in which death is merely a matter of time, we want to go with dignity, not with tubes everywhere. All right? And that's the first thing which can be easily arranged. All you need to do is an advanced medical directive, and that can be arranged. The second thing is to die without regrets, because these are the two big things. To die without regrets is much more difficult, because to die without regrets requires that you start preparing for it now. Okay, we have to start preparing for that now. To die with dignity can be arranged. So we have to realize realities. Everyone must die. The remainder of our lifespan is continuously decreasing. Death will come whether or not you have made time for it. Our life expectancy is uncertain. And there are so many causes of death. There was one poor 25 or 26-year-old girl in Kuala Lumpur just 2 days ago, driving past a very busy road in KL, minding her own business, when a construction crane, one part of that big hook fell right on top of her car and crushed her to death. She's only, 25 or 26, and it was very tragic. And of course, the newspapers made it even more dramatic because they showed the Buddhist nun going there with the older brother and the younger brother, and they're trying to bring her back, bring her home to Penang because she's from Penang, and that of course became a lot of news. But you can see she's only 20 over years old. But these are the unpredictable aspects of life. That's why we say it is anicca. Anicca doesn't mean just impermanence, although we often use the word anicca translated as impermanence. Anicca also can mean that things are unpredictable, that things are unstable, that we can never predict its outcome. All right? So we can find meaning in life even when one of us is confronted with a terminal illness. In fact, I hope you realize that all of us are having a terminal illness. Except how long is that process? We all have a terminal illness. And life is a sexually transmitted disease with 100% mortality. And that good health is merely the slowest way to die. So now, we might laugh, but these are realities. These are realities. And I always tell my friends and Dhamma siblings in JB and wherever I share, I always say that, if every one of you in this room here, me included, knows exactly when we will die. That means I will die when I am 67 years old in the month of August, 31st or whatever. Let's say you know exactly. Actually, that's not a bad thing, because then you will really live your life very, very fully, functionally. You will not waste any time. Petty quarrels become unimportant. All right, whether the husband put the toilet seat up, put the toilet seat down, so what? It doesn't make any difference. Why are we making such a big fuss whether he's squeezing the toothpaste in the middle or the end, The thing is that we make a big fuss because we all think we are going to live forever. The Buddha said, when you know you're going to die, then all these petty things becomes unimportant. So I always say, if you know exactly when, then all of us will actually lead far more better lives. All right, but basically you can divide your life into 3 portions. The typical man lives to 75, the typical woman lives to 80, even for Singapore. So if you divide your life for a man into 3 portions, the first 25 years you study. The next 25 years you work very hard because you have got lots of responsibilities. Now what about the last 25 years? Then you should really devote it to doing something very spiritual. But this is provided you live to 75, but if you don't. So while it sounds very nice in theory, it may not be so in reality. Please don't stand. All right. So, now look at this. This is when you have a very short trajectory of illness and then boom, the person is gone. This is like, for example, the girl that crane fell on her. It's instant. Or it could be someone who had a massive heart attack, myocardial infarct. Within a few days, the person dies. So this very short period of decline makes it very, very difficult for family members to accept because there is no period of adjustment. Like I'm sure the poor girl who died in KL, the parents will be beyond grief, I can tell you. Even the brothers were already, when you see it in the news and all that, it's very dramatic. Because it's so sudden, no one can expect it. People go to work, come out, crane fall down, and that's it, you're gone. Literally crushed to smithereens. So it makes it very, very difficult. All right? And this is the one that requires the most support. And I always share that we call ourselves Buddhist Fellowship. We call ourselves Metta Lodge in JB. We call ourselves Dhamma Brothers and Sisters. Well, this is when you really need to show the support for your fellowship, for your Dhamma brothers and sisters. Because this is a time where they need the most help. Now, I have done lots of funerals. I've done so many funerals, I think the professional Lamalo in JB is very angry with me because we don't charge. All right? And I can tell you I've shared many places. I share. After that, they listen, they sadhu. Then after that, maybe they come back to Metta Lodge once, and after that, that's it. But the ones that have the best investment return are the ones that I do funerals. I am not joking. We had a brother who only comes to Metta Lodge during Vesak Day once a year. Imagine he was one of the early members of Metta Lodge, but he only comes during Vesak Day once a year. He had a son studying in KL. And for some reason that we cannot understand, the son committed suicide. The family was devastated. This same brother had older brothers who come regularly to Metta Lodge. They were all devastated because they all took care of this boy. So they phoned me and they said, hey, Dr. Wong, tonight they're bringing the body back. Can you do a service? It was very short notice because it was so unexpected. So we said, sure, of course. Then I contacted all the members and I said, we must all go support. And so yeah, we all turned up in strength. When I arrived there that evening with my box, with the Buddha image, I've got one box with a mobile Buddha image inside. It serves for both weddings and funerals. Okay, so when I went there, I walked in. The father got no words to say. When the father saw me, all he could do was hug me and cry. Because it's such a short trajectory. What can you say? What can any one of us say? So the only thing we can do is we did the usual service, we did the usual things that we need to do. And then since then, the father has been attending Metta Lodge faithfully every week, unless he's outstation. Because he has seen dukkha. He has seen anicca. He has seen metta. Okay? This Metta Lodge gala dinner, he bought 6 tables and he said, take, give to anyone who wants. Of course, he did. The book also, he done it, and he said, put in my son's name. So the thing is that because we don't realize such things unless we are actually there. You know, we all think we're going to live forever, nothing is going to happen. But the point is that it will happen. So the wise will not learn from direct experience, if possible, because you don't want the pain. You see another person and you learn from there. You learn from examples, rather than why do you want to go through the pain yourself. But this is the type in which it is very prolonged. And then, of course, the family adjusts, friends adjust. Brother Po Ching, remember? He was sick for so long, years, literally years. He was literally like that. So everybody adjusts, including himself. He adjusted very, very well. Is Sister Siu Kim here? No, Brother Po Ching's wife's not here. Okay, since she's not here, I can say something. Near the end of Brother Po Ching's life, okay, we went out for makan as usual. Usually we come for BF sharing, then after that we go out for makan. So I asked Brother Po Ching when he went out with me to makan, I said, hey, how come you didn't bring sister? Because usually in the early days, both of them will come along, but this time, no, he went by himself. So I said, how come you didn't bring sister out for lunch? And he said, I'm going to go before she does. That is an obvious fact. So I don't want to bring her everywhere. I don't want her to be with me all the time, because I want her to have her own friends, her own cliques, her own support group. Then when I go, she will not be suddenly all alone. But if she's with me all the time, when I go, she'll be all alone. Which was very wise. He could see it, and he was preparing for it. That's why near the end, whenever we go for social functions, he would go alone without the wife. He wanted the wife to stay back here, help out with the makan, and etc., etc. He wanted her to develop her own circle of friends. And then, of course, you got illnesses like that. Up and down, up and down, up and down. And this is the type of illnesses in which you lose all your relatives, because after a while, everybody is fed up of you. You see, you go to hospital once, wow, everybody go there and visit. Then by about the 10th time you are in and out of hospital, oh yeah, again. So it also got its good points and had its bad points, you see. But this gives people time to adjust. Okay? So doctors need to learn to accompany our patients through the dying process, because if death is seen as the final enemy of medicine, then we as doctors will lose every time. And I like this picture, an elderly lady holding a baby. What you are, I was. What I am, you will be. So we are alive, therefore we will die. This is the simplest, most obvious fact. Let's deal with it. Okay? So let's make sure we live our lives well, because we are all in this. Now, separation from loved ones. That's the second one. Now, this can only be made easier if we contemplate this before, while we are still healthy. Okay, you know that whatever comes together will have separation. That's just the way it is. And if you have not done this before, then we need to gently encourage and reassure the sick person that the children and those who are left behind are capable of taking care of themselves. Or, if they are small, they will be well taken care of. Because if not, it's going to be very difficult for the person. All right? Now, most of the time, our material possessions, our reputations, etc., become of utmost importance to us. We devote all our time and energy to obtain them, that we actually spend very little time in our spiritual pursuits until it is too late. At a personal level, when the time of death comes, we discover that we have actually ignored it all our lives, and we are completely unprepared. So that's why I'm here today, to help us improve a little bit. So what is death? This is the non-medical view. I'm not talking about the medical view of death. From the Buddhist viewpoint, death occurs when there's a cessation of the connection between our mind and our body. Now please remember that the mind is a formless, ever-changing continuum. It's always changing. It's not a mind, but it's like a river which is always flowing and changing. At the end of this sharing, your mind would have been a little bit different from when we started. But at one point in time, our bodies will break. It can no longer support the mind. And the continuum of the mind has no beginning and no end. It's not male, it's not female, all right? And that mind would carry on as a flow, as a river. So, two nice cartoons to tell you, okay, do not be unprepared. So we should actually think about dying way, way, way before it actually happens. Familiarize ourselves. Death is certain. The hour only is uncertain. Mors certa, hora incerta. Mors as in mortician, hora as in the hours. Okay, certain as in certain, certa. And this is a very important aspect of right view or right understanding for the Buddhists, so much so that the Buddha asks us to meditate on death as one of the standard meditations every day. He called it a protective meditation, that every one of us every day must contemplate on death, because the Buddha taught that when you contemplate on death, then you would live your life more meaningfully and petty quarrels will be unimportant. That means we will prioritize our life. Okay, now death is as natural as birth. As long as there is birth, there will be death. And when there is death, there will be birth. So when you realize that when there is death, there is also birth, then you know that it is not the end. Okay? It makes no difference what religion you and I or your friend or your relative belongs to. Whatever he holds as wholesome and good near the end of the life, let that be his comfort and strength. As doctors, of course, we treat all patients of whatever belief and treat equally with loving kindness and compassion. We do not discriminate. And similarly, as Buddhists, we are taught to love unconditionally. So, when considering the spiritual needs of the dying person, the basic principle is to do whatever we can to help the person die with a calm and peaceful mind, with spiritual and positive thoughts uppermost. I am very happy to know that in some hospice in Singapore, they actually have a room set aside for the person who is going to imminently die within the next 24 hours, so that that person can be moved to that room where the relatives and friends can be alone with them. Because I think that is very crucial. Okay? Peaceful atmosphere is most beneficial when one is sick or dying. This allows for the sick person to rest calmly, and for those who have been trained to meditate, to meditate. Now, if you look at Japan, most people used to die at home. It was the same in Malaysia, dying at home. I still remember when I was young, my grandfather, dying from cancer of the stomach, was in hospital. And then near the end, the doctors told us that please take him home because he's going to die. And then, of course, we brought him home, and within a few days, he passed on. Because I think that dying at home in a place which is familiar is very, very comforting, because the hospital environment is one of the worst places to die. I can tell you it's one of the worst places to die. It's so impersonal, all right? And everything is done in a hurry because the reality is that bed is needed for the next patient. That's the reality. So I think that dying at home is a very important thing. In that advanced directive form, you should state clearly that if I've been diagnosed with something terminal and irreversible, I wish to die at home. Death was part of everyday life at home. 88% in 1951. Now it has only dropped to 13%. Now at one forum that I attended in Singapore, whereby I was asked to speak, the same question was raised. Do Singaporeans want to die in the hospital, in the hospice, or in the HDB? And I was so surprised that very few chose HDB. So then when I, in my Kepochi mode, asked, why not die in your HDB flat? The answer surprised me completely. The answer was, if I die in the HDB flat, its resale value will drop. Very practical, I must say. Very concerned for the next generation, but I'm not sure whether it's entirely right. So every religion teaches us to be good, and the teachings of an afterlife is common to all religions. I always tell people who tell me, oh no, I do not believe in rebirth. I say, do you believe in any religion? Oh, I'm this religion, I'm that religion. Then I say, you're talking rubbish. I say, how do you think you're going to go to heaven? This body is dead already. So you say your religion takes you to heaven. How do you think you're going to be in heaven? For some religion, they say, oh, I'll be given a new body in heaven. I say, isn't that rebirth? Or if you don't believe, oh, you go to hell. I say, you're already dead. Isn't that rebirth? Okay, it's a matter of semantics. All right? And of course, from the Buddhist viewpoint, yeah, whether you're reborn in heaven, or whether you're reborn in hell, or whether you are reborn back here, okay, you're still going to be reborn somewhere. All right? So don't say somebody wants to date you, young girl there, and somebody say you want to date you, then you say, not in this life. Be careful, next life he might actually date you. Okay? Now, here before I skip to the next one, I want to share something very important. 7th month, everybody burn things at the roadside. Singaporeans are very smart. I read it in the internet news that day. They don't burn it in their HDB area. They go to the next HDB area and burn. Because they say don't want to dirty my HDB area in case town council come and check. So I go to the next HDB. But they forgot that the next HDB fella comes to this HDB. But seriously speaking, you shouldn't just burn without knowing why. Why is it that the overseas Chinese have such a strong tradition? You know that this tradition is only very strong in the overseas community. It's very strong in Malaysia, it's very strong in Singapore, it's of course strong in Sabah Sarawak, in Hong Kong, and because in Indonesia the Chinese population is very scattered, you do not see it so much. Actually, there's a very, very good reason. And for that very good reason, this tradition must be continued. My grandfather came from China. I'm sure those of you who are 50 years and above, you will have grandparents who have come from China, or great-grandparents who came from China. My grandfather came from China. Both my grandparents, mother side, father side. My grandmother, slightly longer, her parents came from China. But not many people realize that in the late 1800s and the 1900s, when they came from China, the mortality was very, very high. In Malaysia, they came to work in the tin mines. In 4 years, okay, out of 2 persons who work in a tin mine, 1 will be dead. And these are people who came to malaria, tiger-infested Malaya. Okay? Because my grandfather knew how to read and write. When he came, he got a job that required him to read and write, and he survived. You can imagine for those who left China because of extreme poverty, who could not read and write, they will end up doing very, very hard labor in the docks, etc., etc. Malnutrition, beriberi was very common in those days. Infections, they carry infections, they die. Simple. So among the first generation that came, for example, most were males. They leave their wives behind there to run the families. And then only when they do well, they send for their wives. Or when they do well, they marry another wife here. And it's so common to have one wife here and one wife in China in those days. It was very common. It was quite acceptable. Now, the poor who came over and died, who takes care of their afterlife services? It's the brothers and sisters who came. Okay? It's the 同鄉叔伯兄弟. That means you come from the same village. And so you are a brother. And that's why all the little clan associations sprout out everywhere. Hock San Association, this association, Sam Yip Association. Because they took care of each other. Because who else would take care of each other? And they promised each other that don't worry, when you die, if you die, we will make sure you had a burial. We will make sure we do some offerings. Then, of course, this man being very smart asked, what if both of us die? Okay, both of us die, never mind. Then the other brothers and sisters will take care. What if all of us die? He said, okay, don't worry, if all of us die, those of us with descendants, they will take care. They will be honor bound to offer. And that promise has been kept for the last 100 years. So that's why during this 7th month, you don't offer at home. You offer at the roadside. And who do you offer to? Those wandering ghosts with no families, no siblings, no relatives, no nothing. And what do we call them in Chinese? I don't know whether it's the same in Singapore, but in Malaysia we call it Hao Xiong Di. Why Hao Xiong Di? These are our brothers who came from China. Of course, subsequently there were women, so they have to make it gender neutral. But the first generation were all men. So it's Hao Xiong Di. We all came from China. And these wandering ghosts, if they still haven't been reborn, somebody has to do something for them. So it's a pretty good tradition, which we shouldn't ignore our superstition and say, rubbish, and brush it aside. Because we are the descendants of all these people. We are the descendants of all these people who came and worked very hard to build Singapore today. Singapore is a great port city. You know how many would have died in the docks in those days, carrying with their bare shoulders all the goods. All right? So that's something which I want to share this month. Okay, so death is only one final stage of this life. Please read that little box yourself. Okay? Our karmic links are so strong that we come back again and again and again and again and again to the same circle. So if you read many masters, many lives by Professor Brian Weiss, you will see that it's always the same circle, life after life after life of people, because our karmic links are so strong. And I'm sure Ajahn Brahm also has shared with you all the story of somebody in either Melbourne or Sydney, a girl who had anorexia nervosa, a teenage girl, seen the usual psychiatrist, seen the usual psychologist, nothing worked, and then they thought maybe something in childhood gave her this distortion of body image, which is what anorexia nervosa is. And so someone suggested, this is Angmo, not Asians, someone suggested, why don't we hypnotize her to childhood and see whether somebody laughed at her when she was in kindergarten or whatever, fatty bum bum or something like that made her so obsessed. And so parents in desperation say, yeah, why not? There's nothing to lose anyway. But when they regress her under hypnosis, she didn't go back to childhood. She went one life earlier. And when she went one life earlier, she recalled that she was the younger of two sisters. And she was plump. And her sister was tall, thin, and beautiful. And they both fell in love with the same young, handsome man. Now, who do you think the young, handsome man would choose? Men, big men, of course, chose the tall, slim, beautiful girl. And then what happened? On the day they got married, the younger, plump sister committed suicide. Aha, the psychologist said, we've got the answer. Now we know why she's anorexic. So they want to regress her, bring her out of hypnosis. Oh, by the way, if you guys are interested in hypnosis, we have a brother in Metta Lodge who is a professional hypnotist. Once he hypnotized the whole audience in Metta Lodge, just to demonstrate to us. But he won't do past life regression for you. He said, no problem, no issue, no phobia, no nothing, no past life regression. You cannot handle what you will know. But he will do it for education, for just as a demonstration. Okay? I can invite him here, Brother Tony, very nice man. So when she came, I was going to reverse her, then the mother started crying. And he said, what's wrong? Why are you crying? And the mother said, I had a younger sister. She's plump. We both fell in love with my husband. Now, of course, husband, big fat man. Okay? On the day I married my husband, my younger sister committed suicide. Spams. See, our karmic links are so strong. I can't be your wife. I'll be your daughter. Still within the same family, because our links Our bonds, our attachments are so strong. So in a sense, that is why you should not do any past life regression if you got no issues, because you do not know what information you might dig out that you can't handle. Okay, that's why most venerables will not allow you to do it. Okay? If in your own meditation you have a glimpse of your past life, okay, that's fine. But don't kepochi go and do it. And you suddenly discover that your daughter was your great-grandmother or something like that. And the whole family dynamics all gone. Instead of you scold her, she scold you. All right? Now I'm just going to show you one little clip before we carry on here. I just want to show you this little clip. My speaker has gone into sleep mode, that's why. No, seriously, you don't use it for a while, it goes into sleep mode to save battery. Okay, it's awake now. I can play it one more time. Okay? So don't look down on the seventh month. Okay? Seriously, there are a lot of things that you and I may not be aware of, so do not make fun of things that you and I are not aware of, all right? Okay. All right. So when we are dealing with patients in the ward, we always encourage that if they are indeed going to die, please give the relatives some space. Please allow them to put up religious icons, don't be too strict about such things. Okay, and of course, we must never impose our beliefs on other people. And of course, never do religious activities that are inappropriate or unwanted. And the worst thing, of course, is attempted deathbed conversions, because that's really horrible, because if at the last minute you're going to change it, that's only going to create lots of conflicts and issues in the dying person's mind. And in Singapore, SGH, for example, doesn't allow it, so that's very, very good. They actually have signboards put up that disallow anyone from attempting to do deathbed conversion. I congratulate the authorities for being so far-sighted. And this is just a simple example of an advanced medical directive. Most are much, much more complicated than this. This is just a very, very simple one. If there's a choice, would you want to die at home in a hospital? Who would you want to take care of your last needs, etc.? All right, the typical form will be in great detail, not like this. So we must respect the wishes of the terminally ill, and for those who request for do not resuscitate or AND, allow natural death, then we do not intervene other than providing relief. Okay, so common sense must come in. All right, death is not the problem, it's just a door to a new state. Now, is there anything for us to fear? Really nothing beyond the fear of infectious diseases. It's only the superstitious and the ignorant who fears. There's really nothing to fear. Now, as I already mentioned, the first two, the last one is please allow the family, venerable, pastor, imam to be with the family and the patient, because he not only provides emotional support to the patient or the dying person, he's also providing emotional support to the relatives and the friends. Most people feel very helpless when they are dealing with someone who's dying. Most people want something to be done. Something. And I'm sure most of us realize that the funeral service is actually for the living, not so much for the dead. All funeral services is for the living. So give them time and space to grieve. All right? Now, fear of the unknown, is it really unknown? There have been remarkable progress in understanding this. This is especially within our Buddhist circles. All right? Professor Ian Stevenson is not some fly-by-night professor. He graduated with distinction from his university as a young man, and he spent his entire life doing research on children who remember past lives. He flies all over the world just to interview these children with a standard scientific approach. And if you are keen, just go to YouTube, type his name, and you'll see lots and lots of videos in the YouTube with regard to the work of Professor Ian Stevenson. Now, Professor Ian Stevenson has spent almost 3 decades of his life doing this, so he has a huge database of children who recalls their past lives. He has since retired, but the department continues to be very strong, and the people who took over are still doing his good work. Okay? University of Virginia. Okay? 3,000 over cases in his files. And these are all documented scientifically. Now there's another man called Pim Van Lommel, and he's actually a cardiologist. And because cardiologists deal with a lot of resuscitation, okay, he decided about 15 years ago that he's going to do a standard questionnaire for all the patients who died and then were successfully resuscitated. Okay, and then he published it in The Lancet, which is a very respected medical journal, and his conclusion was that there is survival after death. Okay, that we do continue, because almost all those who survived consistently gave the same account. And this is Dr. Brian Weiss's book. Professor Brian Weiss was at the University of Florida. He's a psychiatrist who also graduated with distinction from his university. He spent his career as an academic psychiatrist, and he was referred a patient called Catherine, who had lots of phobias. Nothing worked. And finally, he tried past life regression, and in the past life regression, over a period of 1 year, Brian Weiss regressed Catherine more than 60 over past lives. And this, he kept quiet because he felt that had he published it, then it would have been the end of his career as an academic psychiatrist. 10 years after he retired, he said his conscience could not stop him anymore. Or rather, his conscience insisted that he do something. And with the permission of Catherine, lots of changed names, he wrote this book, Many Lives, Many Masters. Now, Brian Weiss is a Jew. Catherine is a Roman Catholic. They have got no background in Eastern philosophy or Buddhism. So this is a very interesting book because it's written by 2 people, or written by one person on the life of another, and both of them have got nothing to do with what you and I would call preconditioning. That you and I may say, oh, they're conditioned to think that way. Now, these 2 people have got no training in Eastern philosophy or Buddhism. So it's a very nice read. If you just change a few words, masters, you change to devas. Okay? Because in every life when Catherine dies, after she died, she noticed that there were these, she called them masters, who guided her to the next life. So if you just change the word masters to devas, you've got a Buddhist book there. Okay? So the 27-year-old Catherine sought help for anxiety, panic attack, phobias. Okay? And she recalled 86 past lives, male, female, etc., etc. All right? Now, this is also available in Malaysia and Singapore. Okay, in Singapore, Peter Mac. Okay, Peter Mac of SGH, a surgeon in SGH who has an interest in past life regression, and he does it once a week on Wednesday afternoons in SGH on referral. Again, not because you say, I want to know what I was in my past life, can I do or not? He won't do for you. Only if it is referred from the Department of Psychiatry. Okay? And this is a lady in KL who does it. Okay, she's a lawyer who was very interested and trained in past life regression. So now we have less fear of the beyond. So please give your body away to help another person. Why let it be buried to rot or burnt in cremation? This is the last act of charity or dana that you and I can do. Okay, so please sign up. Oh, Singapore no need to sign up. Don't opt out. Just don't opt out. Okay. In Malaysia we sign up. In Singapore it's don't opt out. That's right. So seek closure. This is very important for all of us. Okay, learn to let go. All right? Learn to let go. There's no book called Dying for Dummies, so we have to learn it slowly. Now this is very, very important. Ajahn Brahm came into the scene in the year 2000 in Singapore. And he came out with something which shocked everybody. He said, you must give permission for the dying to die. And that is very counterintuitive in our culture. But what Ajahn Brahm said is very wise. We have to give permission for them to die. When the body is broken and suffering much, death is a happier option. In the hospital bed lies our beloved in the final hours of his life in this shattered body. It is important for us to separate our loved ones from this shell of a body. The body which is scarcely breathing is far from the beautiful being that we have known and loved for years. Give him permission. Let him be free. And this is very important. Now it's very counterintuitive, but someone has to do it. Give the person permission. Give him permission to let go. Let him know that all of us are well, we are all adults, we are able to take care of ourselves, that you can now be free from your responsibilities. You do not have to hold on for us. Let go, be free. Now when my father was dying, all right, now all these things are very short time. You know, the doctor called me, my friend called me and he said, your father looks bad, come. So I rushed over, I called my daughter who was working in JB at that time, she rushed over, and he was obviously dying. Okay, it's obvious within the next half hour to an hour he will go. And I can tell you, it is not easy to give permission. Okay, I personally found it difficult to actually say it out. But when my daughter came from the office, she said it. She told the grandfather that we're all big, we're all adults, please. Be free, go. And then he passed away very soon after. All right, because we tend to hang on because of our concern, because of our love, and we don't go. And the dying process continues. Remember, you're not prolonging life, you're prolonging the dying process. Okay, the worst thing you can do is go, that's the worst thing you can do. So saying goodbye to the dying, what to talk about, when and how, doesn't come naturally. All such conversations ask of us ultimately what people appreciate hearing at this time of life, words of reassurance and love. So don't wait until the poor man is dead, then he can't hear you. It's hard to say goodbye, but putting off meaningless conversations is probably the number one source of regret. Now, they have actually polled and realized that these are the most important messages that dying people want to hear. Just 4 very specific messages. Please forgive me. I forgive you. Thank you. I love you. Now, I know that in both the services done by BF and the services we do, we have a forgiveness ceremony at this funeral. But frankly speaking, it's a bit too late. Okay? It is still good for the psychology of those people who are there. But seriously, it should be done before the person is dead. Okay? Of course, we still do it at the funeral service. Okay? Please forgive me. I forgive you. Thank you. I love you. 4 simple messages. Reassure the dying person that you understand and are ready. Grant the person permission to set aside the troubles of this world. Sometimes a person may ask you, am I dying? And we have difficulty answering yes or no. So don't answer. Say, I don't know. How are you feeling? Okay, bounce back the question. And sometimes relatives cannot let go, cannot give permission. In this case, it's easier to say, you look very tired. Please don't worry about us. If you need to rest, proceed. Go ahead. I understand what's happening and makes me sad, but I'll be all right, or will be all right. Okay? So being reassured that their loved ones will fare well in their absence helps people feel that they can go peacefully. Because if, as a well-spent day brings happy sleep, so a life well used brings happy death. And people want to be reassured that your life has been a full life. You have done well. You have fulfilled your responsibility as father, provider, husband, wife, whatever. Rest. Okay? Just going to show you a little clip before we go on. Hope he hasn't gone to sleep again.
I get to that state. What I would like to understand is how does one prepare for death or to face death?
To face death, we have to learn a way to face it with realization, with understanding. That means we have to get rid of the fear of death. People, long before they die, they are dead out of fear of death.
Who is this Venerable? This is Bhante Gunaratana. Many of you may not realize he spent 10 years in Malaysia teaching before he went to America. So you're looking at a very young Bhante Ji now.
And therefore they have to learn to face the truth, the reality. They must learn from the moment that we come to realization, we come to reason and understand. From that time on, we must understand that we all are born with one-way ticket. And there is no one single moment that we can go back and change our directions. We continue to go forward with that one-way ticket. And therefore, understanding the truth, the reality, the nature of life itself is one way of facing death without fear. Second is that we must keep our mind as free as possible from numerous psychic irritants such as feeling of indebtedness. There is a particular happiness called anavajja sukha. Anavajja sukha means happiness arising from seeing one's flawless life. Anavajja means flawless life. That is living as clean life as possible. Of course, it is not possible for somebody to live perfectly clean life. But if one learns to make life as clean as possible, then that person can face death bravely and without fear. Buddha said one very beautiful thing he said. He said, mindfulness is the path to deathlessness. Unmindfulness is the path to death. The mindful never dies, the unmindful is dead already. So when we live unmindfully, we are always trembling, we are always frightened of death. When we live mindfully, moment by moment, seeing this death is happening every second, every moment. You know, every single thing in our body, 3 trillions of cells in this body is undergoing changes from the moment we were born till now and into the future. Every second, everything in this body and mind is changing all the time. And therefore, when we see this reality of change, this reality of momentary death of cells, we will realize that these cells will come to a stage where it cannot divide any further. These cells can divide only up to 50 at the time when we are young. As we are older, the cells, number of times these cells can divide will reduce. When they stop producing new cells, these cells will die a conventional death. And therefore, when we realize the truth, we can face death very peacefully and happily.
Okay. All right. So these are very simple instructions then from here. So do not get emotional, pay attention to the moment, take care of our death, forgive and forget. Do not become attached to our material possessions or wealth. This attachment will keep you forever attached to the present and endless rebirths. Okay. Now from the Buddhist perspective, death is not seen at the end. Death is also not the beginning. It's just one tiny part of a whole process. A cyclic process of birth, death, rebirth, dying again, rebirth, dying again. And if one has some understanding or some appreciation of this, then death will lose its sting because it is not final. It's not really the end. It's only the end of one cycle. In reality, there is no death, only transition. And the real question is, how can we live our life now to make our transition as smooth and as easy as possible, i.e. a good death. Be the best person we can be. Death is not to be feared by one who has lived wisely. Eternity does not start with death. Other religions will tell you eternity. Tell them we are already in eternity. For the Buddhists, we are not so concerned about having eternal life. We are concerned about getting out of this eternal life. So be a good doctor, husband, daughter, son, whatever. A day well spent brings happy sleep, so a life well used brings a happy death. There is nothing to fear, but only words left unsaid and deeds left undone. Say it now, do it now. And this is the clock at Nalanda. The time is now. Okay, I thought that was very wonderful. All the Nalanda centers have this standard clock with a word under it. So the death of someone we love can be a very harsh thing, but it's an effective teacher to make us be better people. Death gives us a new outlook on our lives. All right? It is clear all the way through history that whatever religious practice you consider or label or call yourself is really not as important as what we do. What we do in our actions is far more important than the label that we stick on our head and call ourselves, I'm a Theravada Buddhist, I'm a Mahayana Buddhist, I'm a Yaya Yana or Happy Yana, whatever Yana. It really doesn't matter. It's what you do in your life that is important. Okay, now this is a word which is a very old Latin word, amicus mortis. This is what doctors used to do in the old days. Amicus from the word amicability. Mortis, of course, is death. You need a friend at death. Okay, and doctors in the old days used to be playing this role which is now being forgotten. And this is the person who helps the dying person have the most comfortable death possible. And so please have an AMD. Okay, if you have a doctor in your family, it's even better. If not, marry one. Into the family, that is. So these are the principles of a good death. Please read yourself. Okay, now the last line to me is particularly important because I'm a medical doctor. To be able to leave when it is time to go and not to have life prolonged pointlessly. This is something we see sadly all too often nowadays, that a dying person is overtreated. Okay, so we should have the common sense not to overtreat, because you can bankrupt a family nowadays. When some beloved one goes to hospital and then you've got 5 specialists looking after him, and the poor man will be so overtreated, and the outcome is still the same. So common sense have always to come in. And that's why it is very important for us to have an AMD, because it's difficult for the next person, let's say you've got 5 kids, to decide when is it to call it a stop. And it's very, very difficult, I can tell you. So it is actually very important that we actually give them the instructions as to what to do. I've been in an unfortunate position of having to make decisions for both my parents. But because I'm the only son, it was easier. There was no other brother to come and sue me. Okay? Because you see, like when my mom died in SGH, and that was a long time ago when there was no bypass in JB. And so she had to have a bypass in SGH. And a good friend of mine who was then working in SGH did the bypass. But after the bypass, unfortunately, she had a massive stroke. Those days, cardiac surgery was not as advanced as today. So on pump, off pump, the BP goes up and down. And she had a massive stroke. And I was with her in ICU during the last night. And it is obvious to me that somewhere in that night, she actually became brain dead. It was quite obvious. She was already brain dead by the next morning. Now, then comes a decision, off or not off the ventilator. Okay? Because if you're going to keep on ventilating, the heart will still beat for a while. So you have to make a decision to off or not to off the ventilator. Okay? And because I'm the only son, so it was easy for me. And of course, being a doctor, it was easier. She was obviously brain dead. And of course, SGH got 2 other consultants to look at her and both declared brain deaf. So then the decision was taken to switch off the ventilator. Okay? In my father's case, which was just a few years ago, very good support from BF brothers and sisters, thank you. It was a little bit easier because my father had a stroke, and not a stroke, my father had multiple strokes. And he was bedridden for 3 years. And by the 3rd year, he was absolutely fed up. He used to read newspapers, he used to see TV, he still used to follow the EPL, but by the 3rd year, he has completely lost interest. He doesn't even want to read newspapers, he doesn't want to see TV anymore. You can see that he has actually, and you can understand, 3 years of lying in the bed, who wouldn't be fed up? And when relatives come and visit him, he will actually tell the relatives, just let me die. Okay, by that time, all his brothers and sisters have died. In fact, when the one uncle died a few months earlier, we didn't even tell him because he would get even more depressed because his generation were all dying off already. So then when he finally had another stroke, sorry, he didn't have another stroke, he had got an infection and then was admitted to hospital, and then they had to do some emergency operations and all that. And then my colleagues who was attending to him told me that they think very likely he will crash sometime in the middle of the night. So they asked me, ventilate or not to ventilate? Okay, and of course for me then the decision was easy because he had already expressed quite clearly. So I said, no, don't ventilate. If he crashed, let it be. So then of course they are not going to accept it. They said, please sign this form. You're not going to turn around and sue them for doing nothing. You've got to sign. And it was very obvious. Within a few hours later, he developed a lot of pneumonia, etc., and then he passed away. So these decisions are not easy. So to make these decisions easier for your next of kin, make them yourselves. That should I reach this stage, I have no wish to be ventilated. I have no wish to have my life prolonged unnecessarily. All right? You can even state in the form, who do you want to be with you? Okay? You even state, who do you wish to be with you in your last minutes? Who do you want to notify? Etc., etc. Okay? So I wrote in mine, no evangelical Christians, please. I don't want a deathbed conversion. Now, why do I say that? Jokes aside, this is not joking, because we have a good brother and sister in Metta Lodge, and the sister had got 7 sisters. She's one of 7 siblings, some of whom are highly evangelical Christians. So when the father had some stroke or something and was in ICU and comatose, all the sisters, being very filial children, took turns to take care. So they all had shifts. You, what time, 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 what time. So during the shift of the very evangelical sister, the father became converted. How you convert someone in coma, I have absolutely no idea, but the father became converted. And so you can well imagine it caused a lot of trauma in the family, all right? Half the family said, no, how can the old man has, in fact, just before the old man was sick, they brought him to a monastery to offer lunch, dana and all that, and then all of a sudden he's converted. So then anyway, they asked me, I said, never mind, the funeral service is really not that important, it's more for the living. So I say, you feel unhappy, after that we'll do one more funeral service. We reconvert him back, I said. If they can convert him when he's coma, I can convert him back when he's dead. So that was done, we had a second service for him. But the point was the son-in-law, that means the sister's husband, said, the important lesson you learn is you must write in your AMD, no deathbed conversion. All right? So, having lived a life of significance, there's no need to cry when death comes. It's a good death. And you see how a handsome young man there become an old man? So this is not something which is nice, but it's inevitable. This is part of our life. Let me show you some more clips. Okay. Now just let me show you a little bit of Dr. Peter Mack's work. Okay, to reassure you, don't worry, you and I will not die, we will just carry on. Ah, there you are. This is Peter Mack's work. With his permission, he gave me this, and he said I can use it. Of course, he got permission from the patient.
Just keep your eyes closed. Take a deep breath in slowly, breathing in relaxation. And as you breathe out tension from your body. I want you to take a second deep breath, but slowly. Feeling the air flowing up from your chest. Take a third deep breath in and then out slowly. In a moment, we find you a mist that's leading you to your past life, the last past life, the immediate past life that your higher mind will bring you there.
There's trees around. I'm barefooted, black curly hair. I'm alone staring in this vast piece of land in wilderness. I think from afar, I sense or saw that there was a volcano eruption. A lot of people running around.
What are these people doing?
Caught them unexpected, so they were running for their lives. I hear people screaming, as if I'm guiding them towards some caves. I seems to be addressing the crowd, assuring them that everything will be fine. There's this heaviness on my chest now.
Is there emotion associated with the heaviness?
Worried.
Worry.
A sense of burden. Sense of responsibility. A sense of compassion for these people.
Compassion. Anything happening next?
I'm trying to save a young child. They're near the sea. I'm just standing right up the hill, navigating this group of people to head right down to board the ship. The ship sets sail.
Just move on to the next significant event.
I see myself lying in a box. Looks like a coffin. Simple planks of wood. It seems to be staring
Dead or alive?
I think it's dead.
Okay. So where are you in relation to the body?
I'm away from the body now.
Are you to one side or are you above the body?
I'm above the body.
Are you facing the body or are you...
I'm facing the body now. Looking down. And I feel myself floating further and further away from the body. Higher and higher.
Have all your energies left your body?
Yes.
And as you're floating away, how did it feel? Like living this lifetime?
Unaccomplished. There seems to be things that I need to do, I have to do.
Where are you now?
Clouds, I see a lot of clouds. Floating higher and higher. And I see cellulites around, all transparent. The shape of a body form, but not exactly it. They're transparent, and there are just plenty of them moving around.
What else do you see?
I'm still in this cloudy place.
When your soul energy merges with the baby's body in the womb, at the count of 3. 1, 2, 3. Describe your surroundings to me.
Water.
Water.
I'm an embryo.
You're an embryo. How old are you as an embryo?
Maybe a few months old.
3 months old. Look at yourself. Can you describe yourself?
Half-formed features.
Look at your fingers and toes. How are they like?
Half-formed.
Half-formed. Anything else? Look at your body. What do you see?
Little heart is pumping.
The heart is pumping.
Water
Where is the water?
surrounding me.
Surrounding you. What's the color of the water?
Clear.
Clear water. I think we're going to end this session. And in a moment, I'm going to count from 10 to 1. And when they reach the count of 1, you'll be fully alert.
Okay, that's Peter Mac. Peter Mac is as Chinaman as you and me. Don't know how we ended up with such an Ang Mo name. Okay, and it's a surgeon at Singapore General Hospital. So I'm just going to end with a nice hymn, which is often sang at funerals.
Life never dies, although we live in midst of change and death. Only the form shall pass away, and all
Okay, another one of Wayfarers, Dato' Victor Wee's good work. Okay, these songs are all 20, 30 years old. That's why they are the typical 1980s, 70s sort of musical tunes. So I want to end here. I hope I have shared a message with you all that there is nothing to fear because we know, and that you only need to be sure that you are prepared. And I strongly encourage everyone of whatever age to please fill in the advanced medical directive. For the Singaporeans, again, I repeat, your MOH has a standard form for everyone to fill, so there's no need to even look for the most appropriate one in the internet. You already have been given one purpose designed for Singaporeans. And then the fact is that when we learn, when we know, then there is really absolutely nothing for us to be afraid of. It is just another door to another state. The most painful lesson that we must learn to adapt is the lesson of saying goodbye, letting go, because that is not easy. And it takes someone with really great wisdom, insight to be able to do that final deed. And I say it's important because I have a friend, not a Buddhist, a very devout Christian, but very good man who does lots of good work in Malaysia. And he had a sister-in-law who was dying from cancer. And so this is what he related to me. That when he and his wife went to visit the sister-in-law, the wife's sister, she was having quite a difficult time near the last few hours of death. And he said that he got them to tell her to give her permission to die. And then she died after that. So this is him who is not raised in this tradition, who has no knowledge of this tradition, sharing with me how useful it was to give permission to someone who was obviously in a lot of distress and obviously in the terminal stages of life. All right, so that is something important. Ajahn Brahm taught us that in the year 2000. I think it has been an important lesson for most of us then. When they first brought this to consciousness, public consciousness, we find it difficult to accept, difficult to share. But I think over the last 16 years, more and more of us are able to utilize this very important principle. Okay, thank you.
Sadhu, sadhu, sadhu. Now, before the end of our service, I will have some announcement to make. And in the year end, we'll have Ajahn Brahmali year end meditation and Sutta retreat.